Emergency as the number of swine flu cases continues to rise. That is tonight's big story. Good evening. Thank you for joining us. I'm Gabrielle Komorowski in tonight for Kelly. Tonight, 20 cases of swine flu have been confirmed in 5 states, including New York. And officials with the Centers for Disease Control say they're preparing for more. Here at home, healthcare workers are watching for this potential outbreak. News Channel 5's Matt Guerin joined us live tonight from the Vermont Department of Health, where officials have just wrapped up a press conference. Hey, Matt, what can you tell us about that press conference?
Well, Gabrielle, health officials here say they're taking this outbreak very seriously, and you can sense that inside the health department. Normally empty on a Sunday, but today workers were here on this case. Now, here's the situation in Vermont. No cases reported here so far, but the health commissioner says she won't be surprised if cases are reported in Vermont in the coming days. So here's the background. Right now, 8 students at a high school in New York have been confirmed as swine flu patients. Those students had been in Mexico for spring break. Now, Mexico is where this outbreak started a few weeks ago. Right now, hundreds of cases have been reported. Now, back in Vermont, public health officials are telling healthcare workers that they need to watch out for late season flu cases. The symptoms of swine flu are very similar to a seasonal flu, and the health commissioner says people need to work together to stop these germs from spreading.
We are concerned. We have the steps in place to respond as the situation changes, and the most important thing that people can do is pay attention to those common sense guidelines.
What are those guidelines? They are things that you've heard before. You need to be washing your hands. You need to cover your mouth if you're coughing or sneezing. Also, don't touch your eyes or nose. That helps prevent the spread of flu-like symptoms. And if you are sick, they say it's very important that you don't go to work or school. It's important for you to stay home. Now, they also say if you have any other questions or if you feel the symptoms getting worse, you should be calling your healthcare professional. Now, health officials have also contacted school nurses and school administrators across the area. Another concern right now, many schools were on spring break last week in our region. Those students are coming back to school tomorrow, and some of them may have traveled to Mexico, so people are going to be on the lookout for more symptoms. Also in New York, that's where those 8 confirmed cases are right now. The governor had a press conference about a half hour ago.
Much of this city is being shut down for at least the next 9 days as the authorities do what they can to try to prevent further contagion.
New sweeping powers have been given to health authorities to isolate patients if necessary. President Calderon says everything must be done to prevent the swine flu spreading.
This is a serious illness, but one that can be treated if people are seen to in time. And we have enough medicines in Mexico to treat people if they become ill.
For the time being, Mexico's borders, like here in Tijuana, remain open and extremely busy. Few see much reason to stay in Mexico at the moment, and plenty of incentive to leave. Stephen Gibbs, BBC News, Mexico City.
America's on alert. Not yet the scale of the outbreak in neighboring Mexico, but the number of confirmed cases of swine flu here is rising. At this New York school, at least 8 students have already been confirmed as carrying the virus. New York's mayor says the whole city must take precautions.
If you have fever and cough or sore throat, stay home. Do not go to work or to school.
Had a cough. In Texas, one family's already been quarantined, the 2 children among those infected. The Henshaws wore masks to prevent a U.S. camera crew from contracting the virus. Reports of infections have come in from California and as far afield as Kansas. If the outbreak widens, U.S. health authorities could be stretched.
People are surely on edge, like our reporter Rick Sino. He lives in Texas, where at least 2 cases of the virus have already been confirmed.
I'm starting to get a little, frankly, scared because I'm not sure what all of this means. Several websites have it in big red letters plastered everywhere that it's impossible to contain at this point, and it's deadly, and I'm worried if this is genuinely something that we need to be concerned about.
Well, you're probably wondering how the U.S. airline industry is responding to the swine flu outbreak. CNN's Jean Meserve has been in contact with the Air Transport Association. The group says it is, quote, taking this seriously and says this is a time for what it calls appropriate precautions, but not panic. Those precautions include being on the lookout for sick passengers and asking certain passengers to wear a surgical mask when appropriate. It's up to specific airlines to determine which passengers are allowed to fly. Mexican President Felipe Calderón is warning those with flu symptoms to go to a doctor right away or they could face grave consequences. He spoke earlier about the sick in Mexico.
It is important to highlight that of these 1,384 cases with problems, 929 patients have already been discharged. I repeat, 929 of the 1,384 cases have already been discharged. They are back home. This is a total of 67% of all the cases.
Let's go now to Mexico, where the illness was first detected. CNN's Ted Rowlands is in downtown Mexico City. Ted, you've seen Mexican soldiers handing out surgical masks, I understand.
Yeah, absolutely, Don. They were out today handing out those surgical masks to people that were out and about. The vast majority of people here stayed indoors, and that was for a lot of different reasons. The government is telling people to stay indoors. They're heeding that advice. And a lot of the public events that were planned for today, would be planned for any weekend, were canceled. All the masses throughout all of the parishes in Mexico City canceled today, including masses at the downtown cathedral, where usually thousands of people come, canceled masses. The football stadiums here, soccer, as we call it in the United States, matches, they're being played but without audiences. Bars, restaurants, movie theaters, shopping malls, all closed down to prevent gatherings, and that's the strategy for the Mexican government, to help curtail the potential spread of this, avoiding clusters of people around the country. That said, they say they are in a good position to treat any new illnesses, and today the health minister publicly said the problem with those people that died because of this swine flu was because they waited much too long to get help.
Unfortunately, the people who died were patients who arrived in very critical condition. The majority of them, more than 80%, were sent directly to intensive care. They had to be put on ventilators immediately because they already had advanced pneumonia.
Now, tomorrow's a very pivotal day. The last 2 days, obviously, it was a weekend, so they stopped. They basically shut down those events, which prevented a lot of people from going out. And tomorrow is the first day back at work after this 2-day relative calm in Mexico City. The mayor of Mexico City said today, if it proves that there are more cases over the next day into Monday, on Tuesday, they're going to implement more shutdowns, including workplaces and the subway system. They're going to wait and see what happens tomorrow. Well, the question is, then, Ted, are people there observing the government warnings? Is it a ghost town, or are you still seeing some people out and about? Well, there are some people, but when you're talking about a city of almost 20 million people, it is a relative ghost town, that is for sure. And the people that are out and about, most of them, or a lot of them, are wearing masks. And everybody that we have talked to, very concerned and very keen on the situation, keeping very close track of it, monitoring the updates. It's safe to say that everybody here knows of the situation, and most of the people, at least over the last 2 days, have been staying inside. It'll be interesting to see what happens tomorrow when people have to go back to work. All right, CNN's Ted Rowlands in Mexico City. Ted, thank you very much for that. This conversation now to the White House, where the federal response has been swift on this. We want to go to Elaine Quijano. She is there now. Elaine, I understand that members of the CDC, health officials, were at the White House today.
Yeah, you know, this really was a rare event to have a White House briefing on a Sunday, but that's exactly what happened. This was intended to show, obviously, that the Obama administration is working quickly to respond and try to get a handle on this situation. Press Secretary Robert Gibbs was joined by top officials from Homeland Security and the CDC, including Homeland Security Secretary Janet Napolitano. It is her agency that is taking the lead, essentially, in helping to coordinate the domestic efforts on this. And she explained today why the government decided to go ahead and make this emergency declaration. Take a listen.
The Department of Health and Human Services will declare today a public health emergency in the United States. That sounds more severe than really it is. This is standard operating procedure, and allows us to free up federal, state, and local agencies and their resources for prevention and mitigation. It allows us to use medication and diagnostic tests that we might not otherwise be able to use.
Now, she mentioned medication there. Officials say that the government has stockpiled 50 million doses of flu-fighting drugs, including Tamiflu. And Secretary Napolitano today said, Don, that the government right now is working to move about 12.5 million of those doses into places where states that might eventually need them can easily access them if they need to. Don.
Hey, Elaine, do we know exactly who the CDC members and the other health officials met with? Did they meet with the president or just members of his staff?
Well, the president, we should tell you, was actually out golfing at Andrews Air Force Base outside Washington. He was not actually there for the news conference itself. He didn't return until after it was over. We don't know what meetings might have taken place, though, after he returned. Certainly we'll check on that for you. But officials here insist that the president has been getting regular updates, has been kept very much in the loop, and obviously wanted to send out his top aides to tell the American people exactly what the government does and does not know and the steps that the government is taking, again, to try to get a handle on the situation. Don.
Elaine.